Okay, I will call the meeting to order for the neighbors of Dunn County here October 23rd. And I see that everybody is here except Supervisor Wolf. Approval of the minutes. I do have one small change or addition as far as the call of the roll. Supervisor Story was absent, but she was excused absent. Just want to clarify that. Does anybody else have anything to add or change to the minutes? And I'd like to point out right now that Supervisor Wolf is here. Was there any public comment, Carmen? No public comment. And we don't have any public here. There's nothing at the request of the chair this time. And then that brings us, as usual, to our community mentor, Carmen.
All right. So as always, start with.
For a second, who moved and
Oh,
seconded?
thank you. We forgot. Okay. Any questions? Okay, motion second, all in favor of approving the minutes as amended? Aye. Thanks, Tim. And now we're on to Carmen.
All right. So as always, we start with Quality Assurance Steering Committee updates. So this month, our main report was on corporate compliance, which is one of our subcommittees for our QA committee. This subcommittee goes over making sure we're following all of the laws, rules, ethics, primarily focused on billing practices, antitrust practices, HIPAA, things like that. We do twice a year we have that meeting, and then after that meeting, then they report to QA. We had no major concerns. We also go over any sort of Medicare audits that get brought to us for billing purposes. Every once in a while, we'll get an audit of a specific person's chart that was billed to Medicare, and Medicare wants us to send more information. So those happen every once in a while. We actually hadn't had any in the last 6 months, so we were doing pretty well with that. Those are very time consuming for our medical records department, as we have to provide a ton of information, and we send it in, then they ask for more, and then we send it in and they ask for more. And then the outcomes of those are either they approve it. These are claims that they've already paid, so we don't get additional funding or anything from that. If they don't approve it, they would take back money from Medicare. So they're really important for fiscal responsibility, but they do take quite a bit of time. So we talked about that. And we had our pharmacist there, and we also went over quality metrics as we normally do. Are there any questions about QA at all?
Nope.
All right. Chris is online for the employment activity report.
Good morning. Can everybody hear me?
Just barely, Chris. Good morning.
Okay. Morning. So for September employment activity, so types of recruitment was still the neighbors and the Dunn County website, NeoGov. And then for jump down to number of interviews, so we did 4 direct hire interviews, 4 agency interviews. So positions offered for direct hire were 4, accepted 4, and offered and accepted higher than a step 3 was 1. We did have some resignations, kind of reasons listed below. If we go down to open positions, those would have been adjusted with the on and off boarding. We pop down to work comp lost hours, again, another month with no work comp lost hours. And for September, we had no missed shifts due to COVID positives. So uneventful month. It was nice.
Any questions? I was just comparing open positions down there to the last 3 or 4 months, and they just kind of stay pretty close to the same all the time. Not much changes there. Looks good, Carmen.
Okay. Next is resident referral report. So at the beginning of the month, we had 111 residents. If you recall from last month, that was after we had to stop admissions for a little bit due to COVID exposures. We had 76 referrals. We had 17 residents admitted, and we had 59 people not admitted. We ended the month at 117. We had 2 residents transfer to other facilities. We had 1 death and 7 discharges. Our normal referral sources, Western Wisconsin Health was a new one that we have had in the past, but just kind of one-off referrals. It happens. We did reach over 120 residents at one point this month, so that was kind of exciting. We haven't been there in a while, so we've kind of ebbed and flowed. We have had some additional COVID stuff, which I'll talk about, so we're trending back down now just because of admitting capabilities, but we had reached over 120, so that was pretty cool. Any questions about resident referrals?
Looks good. And Brady,
Not a lot to report on this month. We just had 2 days of caring at the neighbors where we redid some of the landscaping in front of Fireside and Deerview. The day of caring was one day, and then we had some volunteers come in from, I apologize, I don't remember.
They were from Wisconsin Bank, I
Yep.
believe.
Yeah, you're right. And then they helped with Fireside as well. We pulled all the old shrubs out and put in new cedar chips in there and kind of dressed it up a little bit. And we'll work with Alyssa in the spring to get some plants in there to make it looking nice. The only other thing we've had is we've lost a janitor for temporary for medical reasons until beginning of December. We are filling that gap with agency person to be working full time, and we've been quite busy with a lot of turnovers in rooms and cleaning, so that'll help us a lot get things caught up, and that person should be starting soon. So other than that, everything's been going pretty good. Busy with work orders as usual, and yeah, that's about it.
And
Austin, thank you. Yeah.
the past few months, we've worked on cross-training a lot of our other facilities, techs and workers from our other buildings. And there have lately been on a rotation over at the neighbors to fill some of the gap from Brady overseeing all 3 buildings. So that's been working very well. And we're going to get 2 of the others from the Judicial Center over to cross-train at the neighbors in the coming months too. So it's been good. That way, regardless who's on call, in the future, they'll have more of the ins and outs of these buildings at the neighbors and everywhere else.
That's custodial work that you're talking?
Our custodial has been over there as well from other buildings, but this is on the facilities tech side.
Okay.
So we have a on-call facilities tech or worker 7 days a week on 1 week rotations. So, yep.
Thank you. Both of you. Is that it, Brady? Austin? Okay. Any questions?
I am going to make one correction. It was Dairy State Bank, not Wisconsin. I apologize. I want to make sure credit is given where credit is due.
Yeah. Okay. All right. You gave us a hint that there's going to be more about 6E COVID update.
Yes. So we have seen an increase in COVID positive cases lately. So on Chris's employment activity report, that was for September lost hours. You will see more in the next time you get that report for October, we've had a pretty significant uptick in COVID. We've had 3 positive staff, 2 of which were therapy staff, so they're not going to show up as lost hours because they're not directly employed by us. And then we had 1 internal staff person. And then we've had 3 positive residents. The residents have all been in the same household. It is our short-term rehab household, so that has also limited some admissions as our other households are all full. So East and West are both, I believe, have 1 open bed currently. And then Deerview is full. So it gives us very limited places to admit people to when Fireside is not able to admit. So our census has gone down a little bit, but not significantly. We're still doing okay. But we have had a few positive residents, and unfortunately, they haven't all tested positive on the same day. So every time a new person tests positive, then it extends it out 14 more days. So we were nearing day, I think, 10 or 11, and then another one tests positive. So it's been pretty much the month of October, but still working through that. Luckily, no one has been severely ill, so that is a benefit. Also, for the COVID update, we will be offering COVID vaccines to our residents and staff if they would like them. I believe that's next week on the 30th. So our pharmacy comes in and does that for us if we do a clinic, which is very nice. That way it doesn't take up staff time. And then they also do insurance billing for that too. So then they can bill for the administration of the vaccine, which is something we wouldn't typically bill for. So it bills insurance. So they come in and they do that, which takes an added task off of the nursing management as well. So that's a service that we get through our pharmacy contract. So then they'll be there. So we're working on getting forms signed and all of that for those who want that. And then they'll be there doing that next week.
Supervisor Lyon.
Do the majority of the residents get the vaccine?
I would not say the majority. When the COVID vaccines first came out in 2021, it was nearly all residents got vaccinated. I believe we were upwards 80 to 90% at that point, and many staff got vaccinated. Every single booster dose that we have, the acceptance goes down. I don't know off the top of my head what percentage it is. I can give that report after the clinic because we'll have people that said they didn't want it when we asked originally, and then the day of the clinic decide they do want it and things like that. So I will get a finalized number of a percentage, but in the past, the booster clinics, it's been 50-ish%, I would say, in the most recent ones. It has also shown, I think there's quite a bit of vaccine fatigue with how many shots and doses and things, because ever since the COVID vaccine came out as well, our flu acceptance rates have gone down too. Are there any questions about COVID at all?
Looks, we can move on.
Okay. Next is senior meals review. I put this on here because there was a question about a senior meals finance stuff from last month, and then I thought it was just a good time to go over what we do with senior meals. We don't talk about it in great depth very often, and since we had a fairly late agenda, I thought it would be something to just talk about. So first, to answer the question from the senior meals financials from last month, when we dug into it, there was nothing that stood out as being out of the norm. What it looked like was more of a timing of invoicing. So things that could have been on either the month before or the month after, based on when invoices came in, was why that one month was off. I believe it was July. May was off due to payroll changes of making sure we were accounting for some staff hours into that, and that was a retro back because they hadn't been counting for it. And then July was the other month that was less significantly off than May, but still seemed different. And when we looked at it, there wasn't anything miscoded or out of the norm. So based on the amount of invoices put in, they were all invoices that should have been put in, but were potentially from just the timing of invoicing, as well as any month that has a holiday in it, there's holiday meals. So that also increases costs too. So the 4th of July does increase costs when we do a holiday special meal as well. So that was the explanation about the question, but just wanted to give a little bit of a rough overview of what we do for senior meals. So we are contracted with the ADRC to provide the food for the meal site locations. So we have 3 meal site locations. There's a Colfax location, Tantera, and then the location that's the old hospital up behind Dick's Family Fresh Market. We supply about 170 meals per day, 175-ish meals per day. It changes every day. We get a count the day before at roughly 3 p.m. from the ADRC about how many meals they'll need the next day. So we have very limited time to make sure that we have the right amounts made and things like that. So from 3 p.m. is when we get the notice, and then they pick up around 9 a.m. the next day for the meals for the congregate sites. It does vary day by day. Tantera has the biggest number of about 100, and then between the other 2 sites, it ends up being a total of about 175. Those counts are sent to us. We make them, we send the actual count back to the ADRC, and then the ADRC pays the neighbors for the amount of meals that are provided. We do supply a portion of an FTE that is a cook at the neighbors. So a portion of that individual's wages, all of the different cost allocations that go to having an FTE, a portion of that does go to the financials of that. And then we have a meal rate that's worked into. Our meals are very similar to what we make at the neighbors, but they do have different dietary requirements. So our dietitian is also directly involved in this process, as the Meals on Wheels program, not only at the neighbors, but across, I believe it's a state wide regulatory program for that, that has very specific nutritional needs that are in each meal. So, and they sometimes vary from what our nursing home nutritional requirements are. So there are slight differences, but typically the base meal is the same. The only time it would be drastically different is if the neighbors was serving something that was very specific to our very elderly folks. So sometimes the things that are on our menu, for example, we every once in a while have liver and onions. We don't send that for senior meals. So on those days, they get something different. So there's some very specific ones, or if there's something that we know is not going to travel well, like a grilled cheese sandwich. That's not traveling well, things like that, we would potentially make an adjustment. And then we also have some differing, like I said, nutritional things. So very similar on the most part. So that does help with the production we're making more of what we already have. But on the days that it is different, it definitely is an added task for the staff. So any questions about senior meals?
Yes, sir, Ms. Supervisor Loafer.
Yeah, Carmen, just curious, what is the cost of the meals per day?
A cost that we charge or the cost that it is?
Right, yeah, the cost for the meals.
I have to look that up. I don't know it off the top of my
Okay.
head.
And are the meals government subsidized by taxpayers, or are they user funded or whatever by those that purchase the meals or whatever?
So there is an at-will donation for the meals at the meal sites. And then they would be part of the ADRC's budget. Sheila actually might be able to speak more on that as she sits on the ADRC advisory committee, but.
I have a question in that regard as well. I just wanted to in thinking about that, the ADRC's budget, is a budget as far as Meals on Wheels is concerned. It was one of the things that has been cut. I'm not sure right now because I've been absent a little bit as to when that's going to take effect, but it is one of those programs that was cut out of the big, beautiful bill and as federal funding. But I wanted to ask though, when you receive monies from Medicaid, Medicare, private pay, is any portion of that, does any of that ever go back to ADRC at all?
No.
Is there, when you buy additional foods to have in your kitchens, when you make grilled cheese or whatever, where do you come up with the money for that? Is that out of your own budget then for any foods that you buy that you put in your refrigerator?
Sure. So we have a senior meals budget as part of our big budget for the neighbors. So there's a separate section called senior meals that has expenses and then revenues. So when we buy food, the basic food too, so not only the additional food, anything we buy, we separately code for senior meals. So Dave in our culinary department, he actually does. It used to be 3 invoices and we also had the bistro, but any food that we buy for the neighbors has its own invoice. Food we buy for senior meals has its own invoice. And then those get directly coded in SAP to go to the senior meals cost center. And then so whatever we buy for that goes into that cost center. And then when we don't directly bill the ADRC for that, they just send us the revenues from the amounts of meals that are sent. So that's why we try to make that basically break even.
Okay.
So it's based on the cost of the food and our labor, and then there's some marginal amount of like electricity and water bill and space because we aren't allowed to, we have to cut out a portion of our kitchen space in our cost reporting because they're not going to resident meals. So that's worked into the price of a meal that's charged to the ADRC.
Okay. So since I've been absent for a little bit, I haven't been quite updated on what the status of that funding is. I don't know, I think, do you know the status of our Meals on Wheels funding as of this moment? I believe it was part of the big beautiful bill and it was cut, but I don't know if it's been put back or if it's one of the things that we're adjusting and somehow, but that's something that I can maybe make note of because it's something we'll have to be talking about in the future, the next year's budget.
Did you want to do a follow-up?
Oh, I just want to say thank you.
So basically, every cost, whether it's a part of a kitchen or a part of a staff, is recouped for the neighbors of Dunn County.
Yes.
And that money has been coming from ADRC budget and the people's goodwill donation of paying for whatever they feel it's worth.
Mhm.
Okay.
Any other questions on senior meals?
Yeah, Supervisor Lyon.
Have you seen an increase in the cost of, ingredients and things over the course of the last couple of years?
Yes. There's been a huge increase in food costs. They have plateaued a little bit. During COVID time frame, when there was significant supply chain issues, we had a huge increase, and then they continued to rise even after that. The rest of the world seemed to kind of settle down. Just we buy from wholesale places like food distributors, so Cisco and Reinhardt Foods, things like that. So it's not the same cost as buying in a supermarket, but it's the same thing. So just how yours and I's food budgets have had to increase when you go to Dick's or Marketplace or Walmart, wherever you shop, so has the cost of food for buying it for distributing to residents and senior meals. And we have adjusted for that in our budget every year. So we do not just do a blanket like 2% increase across all expenses or anything like that. We dive down specifically into each bucket of food. So for example, meat costs have increased.
Bucket of food.
Yeah.
Right?
Category, I guess, would be the better thing. So Meat is one that has gone up significantly over the years, so that's something we look at specifically, and we adjust each one based on what we think they're going up. So, and that's done every year through the budget process. But I will say this year was a little bit less than in the past when Dave, our culinary mentor, myself, and finance sit down and go over all of those things. It's still going up, but it's plateaued a little bit compared to the huge percentages it went up in the past few years.
That was a good idea to talk about that. We haven't for a long time, and good to know. Anything else before we go down to 7? Okay, we're on 7 now. Consideration for action to be taken by the committee, review of vouchers and financial reports. And we have vouchers,
We have vouchers.
but no financial reports.
Correct.
And the vouchers came with our packet, and I think you included them here too.
Yep. So I'll just speak to that for 1 second. So we do have vouchers. Those were prepared by the finance team. The financial reports were something that Beata had prepared. The staff that will be doing them going forward is working on learning how to do them. And instead of getting you a rushed product that may be inaccurate just because they're still learning that process, we thought it would be best to wait till our next meeting, which is in the middle of December as of now, to make sure we have accurate data presented instead of having potentially inaccurate data. So giving them a little bit more time to get that in there. Is there any questions on vouchers that I can answer?
I did have one question down list here. And I noticed that there's a line of contractual / consulting, I assume that second word is,
Okay.
and it's broken down, like there's 6 different listings for that. One in administration, one in housekeeping, one in laboratory,
Mhm.
one in O&M of plants, and then one in operations and maintenance, and one in pharmacy.
Mhm.
And I totaled all 6 of those up, and it came to $27,244.16 for just for the month of September.
Mhm.
Is that pretty common for every month of the year?
Yes. So all of those contractual and consulting is kind of it's the category, expense category that a lot of different prepaids go into, as well as things like our facility staff go in there because they don't report directly to the neighbors, so they're not on our payroll side of things. We pay the facilities department, so they're considered contractual and consulting. The same thing goes, so pharmacy is for our contract with our pharmacy and the pharmacist that consults on all of our medications. So you mentioned housekeeping, that's also facilities. The admin is anything that is a prepaid contract, like annual contract. So our EMR system is a prepaid annual contract. So we split them out throughout every month instead of just having one really big bill at 1 month. So it's split out to be more accurate to the month to month. Things like our therapy contract would be in there, our pharmacy I mentioned, RF Technologies, which is our nurse call system, is part of that. Anything that's a larger contract throughout the year,
Thank you.
of course. Any other questions?
Yeah, that was a good question. I don't see any other questions. And I looked, I know we didn't have financials, so I looked at last month, we were 1.5 in the black, month before about 1.1. It just nods from the back, so we haven't gone down that much, I hope. Okay, then we don't have to look at the financial reports, so I would take a motion to accept the vouchers. Thank you, Supervisor Laufer. Thank you, Supervisor Wolf, for a second. Any further questions? All in favor? Aye. Any opposed? They are accepted. Next, meeting time, did we talk about the 18th last time?
Yes, December 18th is what's currently on the public meeting calendar.
Okay. We're bypassing November. And so we're going for December 18th. Carmen wanted to do it on Christmas, but we didn't.
Yeah, she'd be fine.
So any final comments or anything, Carmen? Any done? Any comments from the gallery? No? Then we are adjourned. Thank you, everybody.